What is a scrub nurse? So pretty much a scrub nurse is a preoperative nurse, formerly known as a OR nurse. They're the nurses that assist in the operating rooms. So they're part of the surgical teams. They're pretty much a LPN or RN that has years of formal training. Um, so they have training in like the emergency room or just they pretty much have been doing it for a long time. And the reason that's important is because they have to know pretty much what's going on in the operating room so they know what tools necessary to hand to the doctors. Or they know how to correctly monitor the patient's vitals and how to properly sterilize a operating room to avoid obviously infections or anything serious as such. Education requirements. So there's a couple different ways you can start off becoming a RN. You can either start as a RN or LPN, or even as a ASN. But it is highly recommended that before you become a scrub nurse, that you at least get your bachelor's degree. The next step would be to pass the NCLEX RN. That's the National Council Licensing Exam. It's a computer-based assessment that covers health promotion, physical, and psychological cares for your patients. So it's just to make sure that you know what you're doing. It gives you a license to do it. After that, you obviously have to have lots and lots and lots of training, because being a scrub nurse, you have to apply for the job and they have to make sure you're up to par. So there's a couple different ways to gain experience. A lot of hospitals start offering what is called a Pre-Op 101. It's a course you can take to get experience for the operating room, or you can just put lots and lots and lots of hours in the emergency care rooms or ICU/CCU. Just because those are areas where, you could be like suturing, and those are some of the things you will be doing in an operating room. Suturing, you have to know what tools are necessary. You have to have a general idea of the procedures going on. That way, the operating room runs smoothly. You have to keep up with your BLS and CLS training. So what that is it's pretty much your licensing, your basic life support, and your advanced cardiovascular life support. Pretty much with advanced cardiovascular life support, that's something that as a scrub nurse you will be monitoring the patient under local anesthesia. So by keeping up to date with this, you're keeping up to date with the things you would have to know in order to perform that job. And then obviously the basic life support is something that all nurses should keep up to date with. It's just a short class, and the medical field is always changing, so it's definitely something you need to know. So they say once you get a scrub, you're a scrub nurse. So just keep pursuing your education. Go for a CNOR certification. So what that is it's not required for OR practice, but it can definitely help you in the future if you choose to change jobs. So it's a good thing to have. Doesn't take long. It's just a good tip. And the fun fact, recommended jobs to look at if interested in becoming a scrub nurse were also circulating nurse, PACU nurse, and pre-operation holding nurse. Those are also nurses that are those are OR nurses, and other jobs you can look into as other alternatives if being a scrub nurse is not something you want to pursue, but you still want to be in an operating room. So what is the average salary of a scrub nurse? So 80% of RNs, which this includes scrub nurses, because scrub nurses are essentially RNs who have through practice made their way up to being scrub nurses. They make on average $46,360 to $101,630 with hospital nurses making on average higher. So, fun fact, the median pay in San Francisco Bay Area in California is a whopping $63.92 an hour. So that's a good amount of money. The average income of a scrub nurse in Florida is actually $63,630 a year. But in our general area, the Orlando area, they make about $29.60 an hour. So it's a pretty good paying job. Pays off in the end. So when we did our essay, we obviously had to look for some job openings for the positions that we're looking for, and I found an opening for a scrub nurse essentially, and on average, their shifts are 8 to 10 hours per shift. Just like this one, you have the option of an 8 to 10 hour shifts Monday through Friday, and they provide you 2 times, morning or closing. So that's pretty much the average for that. So what is the job outlook for scrub nurses? Well, as of 2014, the U.S. Bureau of Labor Statistics predicts the amount of nurses hired is to increase by 16% due to a growth in aged citizens. So obviously we've heard of the baby boomers. Those individuals are getting much older now, and they make up a large chunk of the U.S. population. And since they are getting older, we are going to need more people to take care of their health. So there is going to be an increased amount of nurses needed. So the nurse, and obviously Florida is a retirement state. So we are projected to increase by 25% between 2014 and 2024. So that is a dramatic increase compared to the whole nation. Fun fact, if you have management experience or training, you can rise to administrative or department heads over time. So those also aren't very hard classes. You can go to Lake Sumter, take them. They're short classes, and they can help you in the long run make more money and even go further in this career. So what are some duties that scrub nurses perform? As a scrub nurse, your main job is to assist the doctor in the surgery room. That pretty much means ensure that they're stocked with the proper sterile utensils and supplies. So before even operating, the first thing that the scrub nurses do is that they come in and they set up the operating room. They clean all the materials, they sanitize them, they make sure that there are all the tools necessary for that procedure, or any that they may need. So it's all, as I mentioned before, in order to become a scrub nurse, you have to be an RN with lots of experience. And the reason that's important is because one of the duties performed is that your job is to hand the materials to the doctor. So the doctor can't tell you every 2 seconds what tools you need. You are expected to know what is needed because you are expected to have the experience to know what tools are needed with these operations. The reason they ask that is because it makes the operating room run much quicker and smoother if you know what you are doing. Your job also is to monitor the surgical area and make sure the team has all the material they need. So not only are you going to be assisting the doctor, but you're also going to make sure everyone else in the room has what they need as well. Whether that be gloves, tools, the essentials. If you are certified enough, you can even help with the surgery. So over time, you can gain experience, and if they feel ready or if you have the proper certifications, you can do things like suturing, holding the clamps in the surgery. So sometimes, if you've seen like Grey's Anatomy or something, you'll notice the nurses will hold the clamps when the doctors have to go in and do stuff, things like that, but only well-experienced nurses do stuff like that. Something you do before and after the surgery is you provide care to the patient. So as we spoke before, you keep an eye on their anesthesia and you make sure their health is good. None of their surgery wounds have opened up. You update the family on how that person's doing. Even as they're in surgery, you're going to update the family, make sure they're calm, let them know what is going on, the status of the patient. So it goes beyond just the surgery room. Fun fact, Nurses need years of experience as an RN before applying as a scrub nurse to ensure they're aware of utensils and tools necessary in the surgical room so that it may flow smooth and quickly, as we covered before. So what is the work environment like? So there can be a number of different work environments. You can have like emergency room, the ORs, or even private practices hire their own nurses. So like dentists and stuff, private physicians, those are important. Obviously you have hospitals. Those are much different workspace than you would at a private practice. Or you can even have like the nurses that assist like traveling nurses. No matter what, you must perform proper sterilizing procedures. So the workplace has to be very sterile, has to be clean. You have to make sure you have all your proper tools and that they're properly sanitized. Again, so you can prevent infections. Most surgeries are performed in the day, but nurses can still be called at night and on holidays because obviously there are emergency situations. You never know when that's going to happen, so you should always be on call and ready to work. A fun fact, close to 80% of nurses worked part-time in 2010. Obviously, that's expected to change in a few years with the aging baby boomers.